All right, perfect. Let's get started. Hello, everybody, and welcome to the NICHD Decoding Maternal Morbidity Data Challenge webinar number 1. Today, this webinar is going to cover a few things, and I'll start off by giving everyone an introduction to freelancer.com. From there, the NICHD team will give us the challenge background, as well as more information about the requested outcome. Then I'll walk everybody through this challenge schedule, how to participate in this challenge, and also discuss eligibility. Then we'll close off with a word from Adiona and open up the webinar for Q&A from there. So before we get started, I wanted to quickly introduce myself and the speakers today. First of all, my name is David, and I work on the freelancer.com enterprise team as a customer success manager, and I will be your host for today. Next up, we have Dr. Maurice Davis from NICHD, who is the Health Scientist Administrator. He'll be taking us through the challenge background and requested outcomes. We also have Dr. Allison Cernick and Dr. Regina Burres from the NICHD team, who will assist in answering some of your questions. From the Adiona team, we will have Richard Savoy, who would be giving us an overview of Adiona's involvement in this challenge. And lastly, we'll also have George from the freelancer.com team who will be assisting with some of the questions as well. A couple of housekeeping items just to get started. So number one, this call is being recorded, and the call link and the recording link will be made available through the challenge page as well as being emailed out. So if you have friends or anybody else that you know that's interested in this webinar, rest assured if they can't make today's webinar, they will be sent the link. Number two, please also use the Q&A panel today for all of your questions. When and if you have them, we have a dedicated portion of this webinar for questions, so please make use of that. And if we can't get to your question today, we will make sure to answer them in a FAQ document that will be attached to the challenge page. And lastly, feel free to use the reaction panel or the participant feedback panel just to give us feedback as we're going through this. Okay, so to start off, let me tell you a little bit about freelancer.com. Now, this challenge is being hosted on freelancer.com, and you will have to go through the platform to be able to enter into the challenge. So what is freelancer.com? Well, freelancer.com is the world's largest freelancing and crowdsourcing marketplace by number of users and jobs posted. And so to date, we have over 53 million users globally and over $4.5 billion in jobs posted. And when we talk about connecting users globally, we really mean it. And so here is a map of our users plotted in white on a blank canvas. Pink is where the work is posted, and blue is where the work is being done. Freelancer.com's challenge platform is what we'll be discussing today. And so Freelancer.com's challenge platform allows participants from all over the world to submit entries that a challenge holder can then choose from. And to date, there's been over 1.5 million challenges posted and over $31 million in paid out prizes. Which brings me to the challenge today and the reason that everybody is here, Freelancer.com's largest contest to date. Very shortly, I'll be turning things over to Allison and Maurice, who would discuss the challenge background and requested outcomes, but here's what's at stake. So the challenge offers up to 12 prizes with 7 grand prizes of $50,000 US each, and up to 5 additional winners receiving $10,000. As you can see, there's a lot of money up for grabs. And so with that, it's my pleasure to introduce Dr. Allison Cernick, who is the Deputy Director of NICHD, who will give us an introduction.
Thanks so much, David, and thanks for your coordination of this webinar, and welcome everyone. As the Deputy Director of the Eunice Shriver National Institute of Child Health and Human Development, it really is my pleasure to introduce our team. They have been working with our colleagues at Freelancer and also with our colleagues at NASA who helped connect us with Freelancer to start this challenge process. And this is one of our first forays into the challenge world. We are really excited to try and engage people outside our routine group of investigators. And we know there are many of you out there that have expertise in advanced computation, in data science, and that you may be bringing a new lens to what we see as a really, really vexing problem in the United States, which is maternal morbidity. We do not have a lot of data in this data set related to maternal mortality, but we really want to know is, can we do a better job of predicting which pregnant women will get sick and also very severely sick? And we're making information available to you from one of our existing studies. And the team has really tried to get this data in great shape for you to work with. I just want to say thank you so much for joining us today and learning more about this. And I know that some of this involves registering and working through administrative things, but hopefully at the end of this, what we'll really do is provide new solutions to make sure that pregnant women stay well and that their babies are born healthy. So thank you so much again, and I will turn it back over to David.
Perfect. Awesome. So now we're going to turn things over to Dr. Maurice Davis from the NICHD team, who will give you a project overview and specifically go over the requested outcome. And just to kind of give you an overview of what needs to be done to get you the prizes. So Maurice, over to you.
Thank you, David. Thank you very much. And welcome, everyone. I'd like to just jump right into this. The title of my presentation is our tagline for the data challenge, delivering new data solutions to improve pregnancy outcomes. As a overview, a presentation overview, I know this is a very diverse group of individuals who are attending the webinar. Some of you may be familiar with who we are at NICHD and others may not. So I'll spend a little time talking about who we are, give an overview of the New Moms to Be study, a background of the problem and the topic of interest, a description of the challenge and the expected outcomes, and then we have a question and answer session at the end. Just a little bit about the Eunice Shriver National Institute of Child Health and Human Development, also known as NICHD. We're one of the 27 institutes and centers that make up the National Institutes of Health within the U.S. Federal Department of Health and Human Services. Established in 1962 to investigate human development throughout the entire life process, with a particular focus on understanding disabilities and the important events that occur during pregnancy. An act of Congress that was passed in 2007 added Mrs. Eunice Kennedy Shriver's name to the Institute in recognition of her contributions to establishing the Institute and for also being a champion for those with disabilities. And those of you who are old enough may remember that Mrs. Eunice Kennedy Shriver is the sister of the then President John F. Kennedy. So she's been a champion for actually beginning the Institute. So the NICHD's mission is to lead research and training to understand human development, improve reproductive health, enhance the lives of children and adolescents, and optimize abilities for all. So some of the notable achievements from NICHD include the following: improved pregnancy tests. Today's simple and quick home and office pregnancy tests are result of some of the research efforts funded and supported by the National Institute of Health, and in particular, the National Institute for Child Health and Human Development. Also, by identifying gonadotropin releasing hormones and other releasing hormones, NICHD funded scientists laid the foundation for groundbreaking studies of fertility and contraception and assisted reproductive technologies such as vitro fertilization. Also, NICHD has worked with other agencies to reduce the transmission of HIV from infected mothers to the fetus and infants from about 25% to less than 2%. Also, NICHD studies demonstrated the safety and accuracy of amniocentesis for pregnancy diagnosis, allowing women and their physicians to make informed decisions about their pregnancy using these procedures. And also a breakthrough, NICHD researchers led the first vaccine against Haemophilus influenza type B, which is a bacterium that was once the leading cause of meningitis and acquired intellectual disability in young children. NICHD research also has led to faster diagnosis and monitoring of treatment for choriocarcinoma, a malignant tumor of the placental tissue. So those are some of the notable achievements from the Institute. So in support of NICHD's mission, NICHD funded the Nulliparous Pregnancy Outcomes Study, monitoring mothers-to-be, also known as new moms-to-be. This was a large observational pregnancy cohort study that ran from 2010 to 2015, initially supported by NICHD. Later, analysis and sub-studies were funded by the NIH Office of Research on Women's Health and the National Heart, Lung, and Blood Institute. The overall research agenda studied underlying interrelated mechanisms of adverse pregnancy outcomes. For example, preterm birth, preeclampsia, and fetal growth restriction, in more than 10,000 racially, ethnically, and geographically diverse pregnant women with no previous pregnancy or delivery. Because this study because the women in this study had not given birth before, there was no previous data on how they would respond to pregnancy. So the potential for adverse pregnancy outcomes were less predictable. Data collected from new moms-to-be provided better insight into pregnancy complications without prior risk assignment or intervention. Women were enrolled and monitored early in pregnancy of about 6 weeks and were monitored through to delivery with 4 assessments during the pregnancy period. In terms of the data that was collected, it's a very rich data set. Data collected through various methods included interviews, self-assessments, clinical measures, ultrasound, chart abstraction, and biological specimens. We have about over 1 million specimens, but specimens are not included in this challenge, but I just wanted to share that with you. Medical record review data included demographic information, psychosocial information, dietary, physiological health information, as well as pregnancy outcomes. Data collected through the interviews included medical history, physical activity, medication use, alcohol, tobacco use, drug use, perceived perceptions of stress, reactions to racism, pregnancy knowledge, and as well as the relationship with the father of the baby. So these are just a few. This is a very rich data set, and I only listed a few of some of the information that was collected. So how do you get to the data? The data is publicly available through the NICHD Data Specimen Hub repository, also known as DASH. However, for this particular challenge competition, the new moms-to-be data has been organized into curated data sets that contain almost 9,000, not quite 9,000, but almost 9,000 variables. So it's a very, very rich data set. Via the DASH system, users can access variable level representation of the data, as well as the new moms data set information documents, and like I said earlier, variable information documents as well. There's a code book that you can view prior to registering so that you can see what information is actually in the data set before actually registering. So let's talk a little bit about the problem of maternal morbidity and severe maternal morbidity. The Centers for Disease Control has defined maternal morbidity as any condition, any health condition attributed to and or complicating pregnancy and childbirth that has a negative impact on the woman's well-being and or function. Approximately 700 women, a little more, 700 women plus, die each year from conditions related to or associated with pregnancy and childbirth in the United States. More than 50,000 women experience severe maternal morbidity, which CDC defines as any unexpected outcome of pregnancy or labor and delivery that results in a significant short or long-term consequences to the woman's overall health. Some of the common types of severe maternal morbidity include myocardial infarction, a heart attack, amniotic fluid embolism, where there's amniotic fluid actually seeps out and it gets into the bloodstream, eclampsia, as well as conditions that require transfusions and conditions that require medical ventilation. So what are some of the causes and contributing factors of maternal morbidity and severe maternal morbidity? There's not just one thing that causes maternal morbidity and or mortality. The causes are multifaceted. However, there are some major contributing factors, which include comorbid conditions, chronic conditions, cardiovascular disease, chronic conditions such as diabetes, infections, hypertension, as well as structural and healthcare system factors, such as access to care, lack of insurance or underinsured individuals, disadvantaged and underrepresented ethnic populations, Black, African American, American Indians, and Native Alaskans are disproportionately affected by comorbid conditions. Therefore, it is comprehensive strategies are needed to address preventable contributing factors that impact pregnancy outcomes, specifically in these populations. So what is the overall goal of the NICHD Decoding Maternal Morbidity and Data Challenge? The overall goal is to promote innovation in computation analysis, data mining, and or unique learning approaches by utilizing the NICHD funded New Moms to Be dataset to identify factors that impact maternal morbidity so that clinicians can more quickly and accurately identify and treat pregnancy-related conditions that prevent severe illness or death for a pregnant person. So let's talk a little bit about the description and the overall outcomes of the challenge. So this particular data challenge, we aim to reward innovative solutions that address the need for new open source models that can subdefine categories of risk for, it says mortality, but more so pregnancy-related morbidity. As Allison mentioned earlier, this dataset doesn't have a lot of mortality information, but definitely pregnancy-related morbidity. These models should serve as a springboard for new research hypotheses and novel approaches from the behavioral to the overall to the clinical setting. This challenge will provide a unique approach and opportunity to to risk determination, prediction models for pregnancy outcomes, and the ability to provide insight into large data sets with a new approach. So what should your solution look like? Well, your solution should focus on drawing new or interesting associations from the New Moms to Be dataset that could inspire further research and intervention studies. Solutions could use established, new, or a combination of techniques that discover new innovative outcomes. Such techniques could include regression analysis, association rule learning, classification trees or clustering or decision trees, machine learning, artificial intelligence, or more could be used on their own or in combination with each other to create innovative correlation, association, and aspirations for new discovery and new research. So we looked at the data internally and we came up with some potential questions that you could possibly explore. These are only examples, but the overall intent is to ask a question that you could explore. So from the data, we came up with just a few. So some examples would be, what factors influence the risk of maternal morbidity, including lifestyle factors, pre-existing health conditions, etc.? How does race, ethnicity influence the risk of pregnancy-related complications and poor pregnancy outcomes? What is the relationship between psychosocial stressors and maternal morbidity? What is the relationship between nutritional factors and maternal morbidity? So these are examples to give you some idea of some questions that could be developed or possibly explored while you're looking at the data. So the timeline, we'll talk a little more about this, but the timeline and the prize solution for the challenge will last 5.5 months from launch to awarding of the prizes. This challenge launched on July the 1st, 2021, and potential solvers will have until 5 p.m. Eastern Standard Time on October the 15th, 2021, to analyze the data and submit your solution and documentation. Data solutions must be uploaded to the GitHub account, and a completed submission form must be uploaded to the challenge webpage. All of the instructions are listed in the challenge brief on the Freelancer website, as well as on the challenge.gov website. There are no boundaries to the type of solutions that can be developed, but it must use the new Moms2B dataset, be innovative, and have the potential to improve the lives of pregnant women and mothers. Comparison data sets can be used for analysis, but of course, no attempt should be made to append to the new Moms2B data set or to identify any of the study participants. So how will the solutions be judged? Here again, this information is in the Freelancer site as well as the challenge.gov site. However, solutions will be judged on the approach, overall approach, impact, innovation, applicability, and whether they address at-risk populations. Highly ranked solutions will also be judged on reproducibility, robustness of the unique technique or model, which may include or could include detailed codes, input or output inspection of the files in the GitHub account. So David talked a little bit about this earlier, but as an American Competes Challenge, NICHD will award prizes directly to the challenge winners. So all this information is collected when you actually register. So all of your account information, all that stuff needs to make sure that that's correct. But we will award winning solutions directly to the winner from NICHD. NICHD intends to offer a total prize purse pool for this challenge of $400,000. With up to 7 solutions, at each being $50,000 each, will be awarded to solutions judged the best according to the judging rubric or criteria. An additional 5 prizes at $10,000 each will be awarded to solutions that address populations that are overly impacted by maternal morbidity, specifically women from at-risk racial and ethnic populations. So you could have one group or one team or one individual win a combined total of $60,000 if both prizes fit the criteria. Just to recap again, some very important dates. We launched on July the 1st, and the closing for bids for solution submission is October the 15th at 5 p.m. via the GitHub and the challenge website. And also the federal staff will judge submitted solutions and prizes, and the award will be awarded sometime in early December of this year. I also would like to, at this time, recognize the team. This has been a team approach. We've been working on this for over a year. This is our initial challenge competition at NICHD, and there has been a team approach, and I want to recognize everyone on the team, as well as on the right-hand side, those last 3 bullets, our collaborators, the freelancer.com team, the Adiona team, Richard and his team, Christina Jenkins and her team through the NASA Centers of Excellence and Innovation for actually pulling this off and being very helpful and working together to make sure that we had a successful launch of our initial challenge. Okay, so now at this time, I'd like to turn this part over to Dr. Regina Burris, who is going to talk a little bit about the data use agreement. Regina?
Thank you, Maurice, and thank you all for joining us this afternoon. I'd like to clarify the challenge requirements related to accessing the new mom-to-be data via a data use agreement. The NICHD Data and Specimen Hub is a controlled access repository. Each participant, individuals, groups, and entities must register on the NICHD Data and Specimen Hub website and agree to abide by the data use agreement to access the new mom-to-be data set. The DUA requires that participants have an affiliation with an existing institution, organization, or company, and that the participant and the authorized organizational representative for their affiliated institution sign the agreement. So for individuals with companies, you can be your own authorized organizational representative if you have the authority to enter into agreements and sign contracts on behalf of your company, and NICHD can verify that authority. So for an individual, it would be either an institutional signing official, a business official, parallel for the team. If it's members from the same institution, then it's the team's institutional AOR or signing official. If you have members from different institutions, then since all will need to register for DASH, there will be multiple AORs. If there's an entity, it's the parent entity. For individuals, there is a benefit to having an institutional sponsor, and this relates to when the payment, if you win, the payment goes directly to the individual. If you're with an institution, you can negotiate with your institution to have them, accept the payment. There are tax issues to consider for all of the participant types. There's also, for individuals, there's also the opportunity to pursue an affiliation with an academic institution, a business, or a nonprofit organization for sponsorship for the challenge. Thank you.
Perfect. So just to recap the questions, please do ask them in the Q&A panel. Please don't ask them in the chat section. The Q&A panel would be great for us to go over at the very end. So if you do have any questions, pop that into the Q&A panel and we will answer them at the end. So just to recap the project timeline for everybody, the challenge, like Dr. Davis said, has launched and is live as of July 1st. This means that you can access the challenge link through freelancer.com. Add comments and questions to the comments section or public clarification board. And once you're ready to submit your entry, you have until October 15th at 5 p.m. Eastern time to submit that entry. Judging period follows that from October 16th to December 1st, and winners are announced December 1st. So here's how you can participate. Number one, you will need to create an account on freelancer.com to enter into this challenge. Without an account, you will only be able to see the details of the challenge, but you won't actually be able to enter. Two, read the challenge brief in detail. A lot of questions may be answered already if you have a look at the challenge brief, and specifically a lot of the eligibility criteria that we discuss in the next few slides are noted there. Next up, you will have to register for the challenge by following the challenge registration guidelines. 4, work on your entry, and 5, submit your entry before the deadline. Keep in mind that if you do submit the entry within a reasonable time before the deadline, freelancer.com staff, we will be able to help you review the entry just to ensure completeness. And if the entry is not complete, we will be able to bump that with you and ask you to resubmit it before the deadline. Okay, so let's talk about eligibility. So this is the section that a lot of you have already been asking for further clarification on. So now is the time to pay really close attention. Okay, so I know there's a lot of text on this slide and the slides following, but No pressure in terms of memorizing this, as the recording will capture the slide and its contents. This is also available to you, right, as a reminder through the challenge page. And so in an effort to keep this concise, I will be summarizing these points here and oversimplifying things. However, please make sure that you do your due diligence and read the eligibility requirements in detail on your own on the challenge page. So to be eligible to win a prize under this challenge, a participant, whether individual, group of individuals, or entity, shall have registered to participate in the challenge under NIH rules and requirements. You also do need to be at least 18 years or older at the time of submission. You also need to agree to freelancer.com's user agreements, policies, as well as our KYC verification process. Federal grantees cannot use federal funds from a grant award to develop the submissions unless use of such funds is consistent with the purpose of their grant award. Federal contractors cannot use federal funds on this challenge. If you're participating in this challenge, you agree to assume any and all risks and waive claims against the federal government and its related entities. Each participant warrants that they are the sole author or owner of, or has the right to use any copyrightable works that the submission comprises of, and the work must be original. Each participant agrees to follow all applicable federal, state, and local laws, regulations, and policies. Each participant must comply with all terms and conditions of these rules. Each participant agrees to indemnify the federal government against third-party claims for damages arising from or related to challenge activities. Each participant must register on the NICHD Data and Specimens Hub - and agree and abide by the data use agreement when registering on to access the data set. The DUA requires participants to have an affiliation with an existing institution, organization, company, and the AOR and the participant must sign the agreement. In the case of an individual, you must be a citizen or permanent resident of the United States. You must be affiliated with an existing institution, organization, company to access the data sets on and participate in this challenge. If you're not a US citizen or permanent resident, you cannot participate as an individual. However, you can collaborate with a team whose captain is a US citizen or permanent resident. Up to 10 people can be a part of the team. The team leader must be affiliated with an existing institution, organization, company to access the data sets on and participate in the challenge. Any team members who wish to access the data sets on as well must also be affiliated. The affiliation does not need to be the same as the team leaders. If you're participating as an entity, it should be incorporated in and maintain a primary place of business in the United States. Up to 10 people can work on behalf of an entity. Okay, lastly, with regards to payment requirements, as a condition for winning a cash prize in this challenge, each participant that has been selected as a winner must complete and submit all requested winner verification and payment documents to the NICHD within 14 business days of formal notification. Failure to return all required verification documents by the date specified in the notification may be a basis for disqualification of a cash prize winning submission. If participating as a team, payments will be made to the team leader, who once again must be a U.S. citizen or permanent resident. If you're participating as an entity, payments will be made to that entity. Okay, so with that, we're going to switch things up a little bit, and I would like to introduce Richard Savoy, the CEO of Adiona, to say a few words. Richard, the stage is yours.
Thank you very much, David. Just wanted to give a quick shout out to everyone here and thank you for all participating in this. It's a very exciting project to us because we have some experience in the space and are really excited to see what potential solutions opening it up to the freelancer community could bring. Our company is based in Sydney, Australia. I'm originally American, still a dual citizen. And we have a team here that predominantly full of PhD qualified researchers that we build solutions for a number of different industries, one of which being healthcare and medical devices. And personally, I coached a team that was using digital strategies and data science to reduce smoking rates in pregnant populations of Indigenous Australians, which was a really exciting project to be a part of, and gave me some interest in the space, especially being a parent myself. Partnering, part of the Adiona team, we work with a number of universities, and we're really excited to have Dr. Wei Chen on our team that's helping with this project as well. Dr. Chen is an expert in fetal programming of chronic diseases and is an associate professor at the University of Technology in Sydney. And her research has been, published in 119 peer-reviewed journal papers, and she created the first mouse model of maternal e-cigarette vaping. So we're all very excited about this project, and we're looking forward to see the solutions. I think just for the benefit of everyone here, one of the things that we're looking to see in the submissions is innovation. Of course, we want to see novel solutions and combining different techniques to create maybe unexpected results. But we're also very practical people as well. And so I think from a research perspective, it's important to keep in mind that we're looking for things that are repeatable and reproducible, not just publishable. We're really going to give judging rubric priority to things that have real world applications and can bring real results to the maternal population, especially in disadvantaged communities. So thank you for the time to address everyone. And if you have any specific questions for us, happy to answer them. Thanks, David.
Perfect. Thanks, Richard. All right, so let's dive into the Q&A section of the webinar. And reminder, if you haven't already used the Q&A panel on Zoom to get your questions in, once again, we're not looking at the chat. All questions should be directed to the Q&A. So we will start off with some questions that we've collected prior to this webinar, and then we'll move shortly into the live questions. So make sure you get those in. Let's kick off with this. So can I make multiple submissions to the Decoding Maternal Morbidity Challenge? George, would you like to answer that?
Yes, sure. So hi guys, I'm George, the technical co-pilot who's working on this contest on Freelancer, and you may find me answering questions on the challenge page itself, as well as your questions to NICHD at freelancer.com. And the answer for the multiple submissions is that a team or individual may submit more than one solution to the challenge. However, each submission must be substantially different. So for example, the solutions might look at different comorbidities or create completely different data solutions. You will have the opportunity to explain the differences between your solutions. If the solutions are determined to be too similar, only the most recently submitted or updated solution will be considered.
Perfect, thank you. Next question, is it possible to access and work on the challenge data set out of interest without making the submission deadline? Dr. Davis, would you like to take that?
I can take it, David. So if the question is, can you access the data and not submit a solution, you still have to register for the challenge. You still have to do the DUA to access the data. If you determine that you don't want to submit a solution, we would just ask you to comply with the data use agreement. We ask you to sign and destroy the data in accordance with that.
Perfect. Next question, am I allowed to publish the results of my solution for the challenge, for example, in a peer-reviewed journal, manuscript, or present them at conferences?
I can answer that. The answer is yes.
Easy. Okay, so let's go into a live question here. So I'm just taking a look here. All right, so will all entries become open source regardless of winning or not? Dr. Cernick, would you like to also answer that?
So I'm going to verify with the team because there's lots of details flying around right now. And as everybody can probably imagine, I'm the deputy director, so I'm not tracking every detail. But I think at this point, what we were What we proposed in the challenge document and what we put in the announcement is that we would share the winning solutions, and I do not believe that we are making all of the solutions open source. I'm going to ask the team to confirm that. Maurice?
Yes, you're absolutely right. It's only the winning solutions where we would do that, but not if you're not a winning solution, it would not be an open source regardless.
Perfect. Here's another live question. So talking about DASH specifically, I am currently working as a contractor for NIH. So my affiliation should be NIH. My team members are working for a private institute. Is that an issue? Regina, would you like to?
If you work, yeah, NIH employees are not eligible to participate in the challenge.
Even if you are a contractor.
Or a postbac, or a fellow,
A fellow, right.
or anything. Federal employees are not eligible.
Perfect. So let's go back to some prepared questions and keep those live questions coming in, and we will answer them. Next question, could you clarify what the steps to register are? George, would like you to take this?
For sure. So first step, create an account on www.freelancer.com and go to the challenge page. You can search it by NICHD, Decoding Maternal Morbidity Challenge, Data Challenge, and then look at the following materials to determine whether you want to compete. And these are the new Mom to Be codebook, the study user guide, the variables and published research papers, which are all linked in the challenge brief. And once you decide that you want to participate, please download and complete the challenge registration form and submit it to NICHD@freelancer.com, and also register on Dash so that you can have access to the dataset. And so these steps and much more details can be found on the challenge page, and the challenge registration form accessible from the challenge page.
Perfect, thank you. Next question, along with the new Moms to Be, can other publicly available data sets be used in developing a predictive model?
So I can take that. You can use data sets for comparison purposes, but no attempt should be made to append data directly to the new mom data set or identify study participants.
Perfect. Next question. Now, I would like to register for the challenge with the team. Could you please provide more information around the criteria for teams? George?
Sure. So a team must have a team leader that is a citizen or permanent resident of the United States. The team leader must also be affiliated with an entity, organization, or institution to access the data sets and participate in the challenge. The team members may be non-US citizens or non-permanent residents of the US. It does not matter. All payments will be made to the team leader, and it will be the team leader's responsibility to redistribute this prize among the team members. A team can be up to 10 people, and team members accessing the new Mom to Be data must be also registered in Dash. So to make sure you have all the details, again, go to the challenge page on freelancer.com and read all of the related documents.
Perfect. Thanks, George. Let's go back to some live questions. I know a lot of questions are coming in. Okay, so sorry, still confused about what it means to be affiliated with a company. For example, if I have a friend who has a company which I am not officially an employee of, can I ask the friend to be affiliated with their company and have them to be the AOR? Regina, do you want to answer that?
And
Yeah,
then you can take the broad overview.
Go ahead,
Regina.
Allison.
Let me just explain why we have to do this first, so it's very clear to people that this isn't a check the box situation. The data that we are using is governed by certain things related to the grant that it was funded through, the agreements that we have related to its deposit in Dash, and its subsequent use. Those data and the agreements under that are governed by specific policies at the National Institutes of Health, with which we have to comply. We modified our data use agreement somewhat for this challenge, and that's why you have to register at Freelancer so we can verify you're participating in this challenge. And then we sort of put you in a special category, and we are doing expedited review and sort of a differential review than what we might normally do. The thing about the agreement, as you read it, is that NIH has to have a way to have the authority to pursue an organization. We can't pursue an individual for data protection, data misuse, etc. There are legal standards related to this, and so essentially we can't allow an individual to do this because there's not the same legal standing. So I just want everybody to be clear, this both protects the NIH, but it also protects you. And so we just want to make sure that everybody's clear that this isn't a check the box thing, that you have to have an actual affiliation. In addition, there have been some questions about if I use my university, you know, will you pay our indirect costs related to this work because they'll charge me for it. We can't negotiate facilities and administrative costs under the challenge mechanism. So for those of you in the university setting, I would talk to your Office of Sponsored Research. Challenges are being used more and more often in the federal government, and some universities have now developed policies where either they will reimburse you the prize as part of your salary, and or they will allow you to take part of the prize as a reimbursement and also will then use it to support your research. I can't tell you that based on any university that's available because all of them will have different policies, but I want you to be aware that that's something that we are not going to be negotiating. The reason we are doing this is it doesn't operate like a grant. We won't be negotiating with your universities or your small business. This is a cash prize that will be paid to the team lead. So I'm just trying to make that as clear as possible to everybody. Now, if you are, let's say, you have an LLC or you have a consulting company and you are the sole proprietor and you do work and you are registered as a company and you participate in these things, you are your own AOR. So you can sign on behalf of your company because you have the authority to do so and to enter into agreements under that. So it's a legal thing, and I apologize that we have to, you know, we have to do that sometimes, but this is relative to the regulations that we have related to data protection, as well as some of the authorities we have to share this data. So I hope that made it a little bit more clear, and you'll have this recording so you can go back and try to decipher the bureaucratic mess that I just said. Thanks so much.
Awesome. So another question here. I serve in the U.S. Army Reserves, motor vehicle operator as my job. Being a federal employee, am I eligible for this challenge?
Oh, that's such a great question. NIH employees, definitely not. That's a great, you know, I'm gonna have to go back to OGC and clarify that. Because I think I said federal employees, I know it's NIH employees cannot. Let me check on federal employees with our Office of General Counsel. And is there a way to share this back after the session?
Yeah, so we will gather all other answers and questions in the FAQs document, and we'll share that on the challenge link.
Perfect.
So whoever asked that will, yeah.
Yeah, and Alice, as I'm thinking too, we probably need to clarify not just federal employees, but HHS and employees in particular, because that question came up too in the chat.
Okay, perfect. I'm just going to pick maybe one more. Okay, so we will be a global team with our team lead as a software employee in one of the in a company. Can we add that company as in the institute and proceed to apply? The team will be working on the challenge and the team lead would just represent. Is that acceptable? So we will be a global team and the team lead is a software employee in a company. Can we add that company as the institute and proceed to apply? The team will be working on the challenge and the team lead will just represent. Is that acceptable?
Is the team lead, I didn't hear the part about the team lead being, is the team lead a US citizen or the institution a company based in the US?
Yeah, so maybe whoever asked that question, maybe just clarify and then re-enter your question in the chat here. Okay, so let's move on to another one of the prepared questions. So I intend to sign up for this challenge, but I wanted to ask if the makeup of a team has to be complete at the time of sign up. I intend to mainly work alone, but I have 1 or 2 people that could end up advising. As long as they meet all the criteria of the challenge, is there any issue with adding them as team members at a later date?
And we may need to clarify this some more, but all team members would need to register and sign up the DUA. So adding them over time may present an issue. So if the team is, I guess, formed prior to would be the better option instead of trying to add as you move forward. So I don't know if Regina, you have any.
I had edited this, and the response is team members who are not part of a challenge. Well, you need to be on the challenge registration form to clarify this, to be able to register in DASH to access the data. If at the end of the day you submit a solution and you have team members who have accessed the data but were not reported or registered in DASH, you will not be eligible to win a prize.
Okay,
that would invalidate your entry. Yeah, because you didn't follow the instructions, rules.
Yeah, and I think the only other thing to say, because I'm seeing some questions in the chat, and rather than responding to each individually, I would just encourage people to think about their team. And I understand the need for the affiliation poses some problems. But please know that when we look at the data use agreement, the people accessing the data will have a need to know on the data. And so you are signing a legal document and you are entering into an agreement with the federal government to access this data. So please don't treat that as a check the box exercise where you find a friend in the United States and have them register as an LLC and then affiliate with them and access the data. Also, please consider sort of using a business as a proxy. Those could be pretty dicey things to do. And we will be looking at the affiliations and expertise of the team. So they need to have some relevant skills and abilities, and they need to be actual team participants. Just like any other research process, this has to have some integrity to it. So I just want to make sure that people are very aware that we will examine that.
Perfect. Another question here. What can I expect from the new moms to be data set after I have access to it?
I can take this. So as Maurice said, Maurice, the challenge data set has over 8,000 variables, 8,800 to be exact. The code book for new mom to be is available on the in the challenge brief. It's available on the DASH website. It's available on challenge.gov. So that's a great place to start with your solution, is to review the code book. And there's additional documentation available as well prior to accessing the data. So you have the code book available to you as a resource prior to accessing the data.
Awesome. Here's another question. What steps do I need to do to receive approval for access to the data set? What is the expected timeline to receiving the approval if I've properly completed all the steps?
So to receive approval for access to the data set, you need to register on DASH and submit a data use agreement signed by your authorized organizational representative. once the DUA is accepted, final approval is expected to take just several days. We're expediting approval on these DUAs for the challenge to get you the data as quickly as possible.
Perfect. So I signed up for the challenge as individual. Now in the request for the data, I'm asked about my authorized organizational representative, AOR, to sign the data usage agreement. I don't have one because this is an individual challenge and not affiliated with my institution. If this does need to be through my institution, how will the prize money be given? My institution is not likely to participate as it is signing official in an individual project not related to my work duties.
I think Allison addressed this question with her earlier response. The real answer is you need to negotiate with your institution. We would love to have you participate in the challenge, but we can't negotiate for you. It's to your advantage I would say, to negotiate with your institution so that you can participate, and so you don't have take that tax hit as a winner. So there is a benefit there, but you will need to negotiate with your institution. Yeah.
So let's go back to some live questions. So I already have a data use agreement in progress of getting approved to access New Moms to Be for another research project. Would I need a separate DUA specifically for this challenge? Maurice, do you want to answer that?
Yes, I was typing the answer. And the answer is yes, because the request for the New Moms to Be was probably for another project, another outcome, the whole thing. So yes, you would need to register separately for access to the curated data set for the competition.
So, and I can, it's definitely worth the effort to do it because the basic New Mom to Be data is 79 separate data files, and the challenge data set is a merged data file. So we've done a lot of upfront work for the challenge participants, and it's definitely worth doing. Plus, you need to have the data use agreement through the challenge to qualify for submitting a solution.
Perfect. Another question here from the live Q&A. Does the data have primary diagnosis in ICD-9 or in ICD-10 codes?
Good question, and don't know. I'm just being really honest. I don't know. Regina, do you have any idea? We'll have to table this and come back. But
yeah, we'll have to check. I don't know if it's in the code book. Yeah.
Perfect. So one last prepared question and last chance for Q&As, live Q&As. So if you have a last question, please get it in. I read the eligibility criteria for the challenge, and it appears that a participant can be an individual who is not affiliated with the institution. If this is the case, then what should that individual fill out in terms of the data request AOR?
Yeah, again, this is the question that led to the clarification. We added the slide to address this, and Allison addressed it earlier as well. So all challenge participants must be affiliated with an existing institution, organization, or company.
Perfect. And so with that, we're going to close out this webinar. Now, if your question was not answered, once again, we will work to answer those and share those in a separate document. So please look out for that on the challenge page. Okay, so everything will be on freelancer.com. Thank you so much for joining this webinar, and we'll speak soon.